Welcome to another episode. And with this episode, I'm going to be interviewing co-CEO of Richmond Integrative Functional Medicine, Becky Hartman. We're going to learn a little bit about her health journey and what kind of got her into this field, as well as how it's impacted my practice. Welcome today, Becky. And let's start talking about your health story, your history. When did you first have a health event, a health issue? Like, walk us through some of your health crises up to the current point.
I feel like I can go pretty far back and actually find some like little things. The further forward you get, the further in this journey you get, the more you can go backwards and go, oh, like I wonder if this was a thing. For instance, in my freshman year of high school, I actually threw my back out and hobbled around school for a couple weeks while I healed after running the mile in gym class. So that was kind of interesting. But then the next really time where I feel like my health really affected my functioning was in grad school. And I honestly kind of chalked things up to like, oh, finally, I guess school's hard enough now that like it's taking its toll on me. And later on, I kind of put some more pieces together. But I had anxiety for the first time in my life. I actually, interestingly, I didn't gain any weight then. I actually, if anything, probably stayed kind of thin. But I'm sure I probably lost muscle during that time. But, and I just really, really struggled to keep up with school. It's like my brain wasn't functioning properly. I had brain fog. And the anxiety was probably the worst part of it. That was the part where I was kind of you just feel like you can't get a handle on things. And that was really the first time. And as it started we started classes in the summer, this issue happening. And it actually was probably the worst the second semester in. It kind of escalated over the summer, and then that first semester, I even struggled to keep my grades up and keep up with my classwork and stuff like that. And then as time went on a little bit, I kind of got some strategies in place, and I got a little better handle on things, and I kind of got it together and started to succeed again in school. And I just thought, oh, I'm finally getting the hang of things. And then
one of the things I really remember with a lot of that, because when we met, it was probably a year, 2 years later.
It would have been the next year, I think, after.
That you kept on telling me how many times you almost dropped out of school, you almost quit, except for your roommate. That was something and I remember thinking, okay, that's over exaggeration, et cetera, et cetera. And I think recurrent exposures have been anxiety, I think has been an ongoing kind of thing with you. Let's fast forward to when we kind of figured out what was going on back then, how we kind of put the pieces together. Almost 15 or 20 years later, we actually figured out why you had this debilitating anxiety, and what kind of clued you into that.
So I noticed, I went to visit my parents, and they had put in new carpet through the main parts of their house and into the bedrooms and everything. And I noticed that by the end of the visit, I slept there and everything. And our kids were not super young at that point, but I really felt just loud. I wasn't sleeping well. I actually got home and felt pretty sleepy for a few days after I'd gotten back. And I thought, I wonder if something's going on with the carpet. And then another time I was actually traveling for a homeschool conference to learn how to educate our kids. And they had just remodeled the whole, and redone the whole hotel and redecorated, new carpeting everywhere, new carpeting in the rooms. And you could smell it. I mean, you could smell that it looked lovely, but same situation. I was at the conference, and I remember one afternoon I actually had to go back. We had some free time, and instead of hanging out with friends, I actually went back to the room to take a nap because I was just zonked. I couldn't, I just wasn't normal, and brain foggy, same kind of situation. So it was sort of what's going on here? And that's where you sort of take those pieces and start to pull them in and go, like what's going on. These are both like carpeting situations, what's in carpet, you know, making those connections.
It's really interesting because eventually, like the light bulb, now, give credit where credit's due. I'm not sure how much of your input or my input, but just the light bulb went off. Because I remember specifically going to the same anatomy lab you went to, because you mentioned later, oh yeah, anatomy, and just the light bulb clicked in my head. I knew that anatomy lab. I knew the place that was filled full of formaldehyde that I was at for 3 to 4 months straight. And it was also a click, like that's when you had a massive formaldehyde exposure for like half a year straight, maybe.
Yeah.
Yeah, and so that then started the whole chemically induced triggered anxiety, fatigue, all those kind of things, which led into other health issues. And we want you to walk us through some of those, because you had some issues where you actually had debilitating fatigue for about 5 years, where you were hardly even functioning.
Right. So, the fun thing about being married is I remember it a little differently. I remember coming to you and asking, do you think it could have been the anatomy lab and like all of that? And we were both looked at each other and we were like, oh my gosh, that's totally it. And so, yeah, so that was kind of where we put that giant piece together, that this is like started this cascade of other issues over decades, really. But yes, when our kids were, we've shared, a lot about our family and some different stressors that we've had with our kids' adoptions and things like that. And so I certainly bore a lot of the brunt of making certain things happen and just pouring myself into helping our kids from hard places, and which was stressful. And I think, that in and of itself probably also impacted my health and led into some weight gain and things like that, where I was like, oh, let me see what I can do about this. And so I started a program that was very ill-advised and essentially set off a 5-year journey of debilitating fatigue and struggling to function day to day. And it felt impossible to get out of bed, but I had to, because I've got kids with special needs who needed a mom who could be their arms and legs. And that I still don't kind of know how exactly I got through it, but it led me down a path of like trying to figure out how I could fix myself and get better.
And that was also like one of the fad diet kind of thing, where I think you were doing like 500 calories a day, maybe. It was really low for a month straight, taking these supplements. So basically you're going into low-grade ketosis, burning off lots of fat and releasing fat soluble toxins, which your body, and we've since learned with your hypermobility, you have a high protein need to help detoxify. And so basically it was like the perfect storm of releasing these toxins from fat melting, not having enough protein in your diet to cope with that, and just basically this a bit, back then we were called it adrenal fatigue,
right?
Which was all the rage back now. We know it is basically a kind of neuroendocrine dysfunction. The technical term would be HPA axis dysregulation, where the toxins overload hit your brain. Your brain's like, I'm done, I'm out, and created basically a chronic fatigue syndrome, which is what chronic fatigue is. It's inflammation in your brain. And so, and that took about 5 years. We some of the things we were able to do, including PEMF for pulsed electromagnetic field therapy, which is a really cool way. Actually, it's really interesting. You can actually, it's a way to activate your parasympathetic nervous system. And the cool thing about it is that it can help re-regulate some of these sympathetic, parasympathetic, fight or flight abnormalities. But it was, that trigger on top of the previous stuff that accelerated things, nutrient deficiencies as well. Where are you at currently with your health? A lot of times we talk about on search about our kids. Haven't really talked about myself that much. We haven't really talked about you a whole lot. Where are you at currently with your health? Because you've had these ups and downs and crashes, times where you've been so, actually crashed so bad you didn't think you could, it's almost like a trauma response where you're kind of like, oh my gosh, this is all happening all over again. Why don't you walk us through that, the mind, because that's a big part, because it was like the anxiety part, we know how the chemicals affect anxiety, but then we had our family trauma stuff happen, and then your medical trauma. How did that play into, like, every time you had a setback, how did you respect, what was the process of that?
So if we could go back a little bit further to where I still was like struggling with the fatigue, just an example, and I'm sure a lot of people watching or listening can probably relate to this. I, for instance, would be like, what I really need to do is exercise. Like, I got to build this muscle back. And I would try to work out, and I would get, I would do like high intensity intervals or something, and which is, 30 seconds of like intense whatever. And then I would immediately feel sleepy enough that I could go straight to sleep, which is weird, probably not super functional. So that's kind of where I was. And that was, once I was at a point where I even could consider trying to do something active. So that was like not even at the worst of it. But so that's kind of where I'd come from. And then that, because part of my issue was related to the fact that I did something really stupid and tried this fad diet that tanked me. And then I also continued doing it when I started to feel really poorly on it, because I was like, I'm not a quitter. I don't quit things. Like I do whatever it takes.
Sometimes it's good to quit bad things, right?
Right. Yeah. So that, that really got me into that mess. And so then, as I progressed toward health and started healing and really addressing a lot of the issues, and fatigue wasn't as consuming, I would try to do things like we took a trip and we tried to just walk to the top of a tall hill. It wasn't anything that I would even consider particularly strenuous now. But because it was just a walking path, people were probably pushing strollers up it. It was steep, but it wasn't like I was hiking up the side of a mountain or climbing up rocks or anything. And I got not even halfway, I think, up, and I started to feel that just that feeling of fatigue sort of creeping in, and like it was getting harder. And then anxiety kicks in, and it starts to get hard to breathe because you're feeling anxious about it. And then that in my body would make me feel like I'm crashing. And I fled the scene of that experience, because I was like, I have to get down off this hill. Essentially my body was communicating to me that I was near death probably. And I just thought, I'm going to crash again. And in my mind, I'm thinking, there goes another 5 years that I'm going to struggle again and not be able to get out of bed and miss out on my kids' lives. And, you stepped into so many things and took over for a lot of my responsibilities. And I just feel like I missed so much. Like, I thankfully had a great, amazing support system that was willing to step in and do things and come home and not have dinner and have to make it after a full day of work and all these things. And, the fear of going back there again became the thing that was the most debilitating.
And this is on top of 3 kids with special needs, dealing with their therapy and medical appointments, their education, on top of trying, dealing with just being married, this life. Was there a particular stressful, traumatic event that also triggered some health issues for you?
Yeah, so thankfully it was after the most debilitating part of the fatigue aspect of things that this happened. But our son had an accident, and I ended up in a very like sympathetic overdrive state, and sort of I always had like this sense of foreboding that like horrible things would happen. I would be afraid if you took the kids out and did things, I'd be like, it was like not really rational, but like I was afraid of everything, like car crashes, somebody falling into a pond and drowning, like, anything. I just had constant anxiety. And after that process of Obviously, there was like the acute stage of like, you know, he was hurt. Then he was sort of okay, but not all the way okay. And then we had to do like a lot of appointments and figure out what was going to be like the long-term effects of the accident on him. And then after that, it just became this like just constant state of like me panicking about things. Like,
And to put things in perspective,
years.
Our son was actually crushed in an elevator.
yeah.
So those kind of accidents, kids, if he's a miracle, he's alive. They usually don't actually make it through that. And so there's that 8-hour drive back from Kentucky where you were just kind of like, you know, had time to ponder what was going on. And then one of the results after that was that every time he disappeared, we live on a farm, and our son Claire will disappear. And if you didn't know where he was at, all of a sudden, like that trauma, like this, you'd spiral. And the thing was, he popped back up a few minutes later, and still take you 4 to 5 hours to kind of gather yourself. It was this pathologic limbic kindling kind of thing. And you actually did something that actually broke that cycle. So talk about that.
So I probably worked through some degree of it just, you know, as time was passing, and a lot of different things that I tried related to like food and movement and things like that, you know, I was on a progression of like getting a bit better, but it wasn't gone. Like it wasn't going away. It wasn't, you know, we hear time heals all wounds. Well, usually it's a lot of hard work. It has nothing to do with time. It takes time to do all the hard work, but it's not necessarily like I can just sit here and whatever this issue is going to go away. And I think 3 or so years after his accident, 2 or 3 years after his accident, I participated in a breathwork session that was like pretty intensive, and we actually often link to it in our communities and stuff. So Sachin Patel does it's called psychedelic breathwork. It has nothing to do with consuming any psychedelic.
No drugs here. No drugs here.
Psychedelics or anything, but it's like the process of the breathing and the different. It's a little wacky seeming to some people, and one time of doing that, I did it live on Zoom with a group of people. So, you know, you had a little bit of feeling like I can really press into this. I honestly wasn't sure if I was going to do it. I was like, this seems a little out there. I don't know, like, what am I opening myself up to? But I went ahead and participated, and I can truly say from that moment forward, that panic, that like just that foreboding thing where I would worry all the time that like, you know, everyone I love is going to perish in a fiery crash or whatever, didn't happen. It hasn't happened anymore ever again since then.
It was really interesting kind of with that psychedelic breath with Sachin, because from my perspective looking at it, it's like using your breath as a way to activate your parasympathetic nervous system, which is your rest and digest, your healing part of the immune system, but to do it almost in a pharmacologic drug-like way where using your breath as a vagal nerve activator. And I've been in rooms, I've done it actually 3 times, and been in rooms of like 100 people. And it's, you know, it's basically the breath work gets you to a place to actually let your body kind of heal, which sometimes we don't get into because we're so busy and we don't have time to like sit. And doing breath work and those of you out there that are like, oh, biohackers that are in the whole biohacking thing might be familiar with this, where you hyperventilate, you blow off CO2, and what happens, you get, you know, constriction of your vessels, then you do some slower breath, and then you get higher CO2. And so actually this is actually almost like massaging in a certain way your central nervous system. Very, very powerful. I've been in rooms with people, and they have these breakthroughs with their own trauma. They go back to these past events and get healing. It's the point of me sharing sharing that is that there's a lot of trauma work out there, not just EMDR, not just tapping, that actually biohacks your brain and bypasses these what appear to be, you know, irrational fears, irrational concerns that every time our son disappears, he's dead. He's in the pond somewhere. He's floating somewhere, you know. And it's like, no, he's the now 13-year-old boy that does 13-year-old boy stuff. But that's that irrationality of it. You talk someone out of, trauma work actually can take people through that. And so we've done a lot of this stuff. And it's interesting, I think part of our story, me being a functional medicine doctor, you being a health practitioner. For those who don't know, my wife, Becky, actually is a pediatric OT by training. So her field of expertise is actually kids with special needs. And so it took us like some of these things 10 or 15 years to kind of figure out. So it wasn't overnight, it was a journey. And so we could talk about this for hours. We've actually discussed it back and forth for years. Do you have any parting thoughts to share with people? Encouragement about their health journey? Because sometimes it seems impossible. There were times where it seemed like, you hit a dead wall, like this is your life for the rest of your life.
Right.
And there's times where you have these really great insights. What advice, help, perspective would you give to people as far as their own health journeys from your own personal experience?
I think one huge takeaway is it's really important on the front end or wherever you are in your health journey to understand that healing is nonlinear. You're not going to just, start on a path and you make a clear, I'm here and I'm always going in this direction, and eventually I end up, in this better place, whatever this better place is, or I'm healthy or I'm whole. As it's, we've just discussed, I had one debilitating fatigue situation, and I was definitely much better than that, and then ended up in this other situation after our son's accident. But I did have tools going into that I wouldn't have had if I hadn't had the other difficulties and the things. So we talk often about how we believe you were made for health. We were made for this. We were made to heal. Our bodies are made to heal. It isn't the story is always being written. The journey's always happening. We're not kind of probably never arrived. We're always going to have new things that we need to contend with, but you also bring those tools with you to the next thing. And it's really important to try to look for that stuff. And then the mental battle has been the hardest for me. The psychological piece of not just always feeling like I'm going to go back there again. And not that I'm more wise now. I understand to listen to my body, and I'm much, much, much more careful. For instance, we went and did a really cool thing in a Swiss clinic that was, meant to be this great week of detoxing your liver, and they had all this food made for us, and is a neat thing that we got to do. And I went completely toxic while we were there, and knew immediately that I needed to go talk to them. And you helped me navigate changing the plan so that it would fit me, and I needed protein I wasn't getting. I needed something to support the detox. So that type of situation, we just tackled it. I didn't have to feel like I'm going to die or be, triggering this fatigue. We saw it happening, and we were like, we got to do something about this. Not just I'm just going to push through because they know what they're doing. It was no,
well, actually,
help me.
They actually did. And that's where you have to figure out, I'm people's guide. I tell them I'm their consultant, ultimately it's your journey. It's the patient's journey. And they have to know their body well. They have to be educated enough and attuned to their health enough. And it was really interesting, that situation where they just changed to a plant-based vegan diet for the detox, which was lots of living vegetables, living food, right? A vegan's paradise, but almost no protein. And when you start feeling bad, it was kind of like similar symptoms you had before. I'm like, let's get a blood count, because I was worried about you having a kidney stone or infection. And your white count was 22,000, which usually when you're septic or you have pneumonia, it's that high. And then they check your CRP, which is over 15, which usually happens with bad infections. And literally giving you egg whites and amino acid capsules made that go away. And that was one of those things, it's like, my wife is toxic, not in a bad way, but you actually have a lot of toxins. And when you ramp up phase one detox, if you know the protein's sitting there, your body's going to freak out. And so it's one of ours that kind of played back, and then we look back in the past to reinterpret the past, knowing that you just need more protein to detoxify. You feel better with whey protein for a reason. You feel better on a high protein diet for a reason, and just putting that bit of information in your toolkit take along. And next time someone says, "Hey, I got this great new fad diet," you're like, "Yeah, not here." So it's great. Thanks a lot for your time, your input. I know we'll be talking later on about some other things you're doing. Thanks a lot for sharing with us and the audience your experience. Of course.
Of course. I love our people.
Excellent. All right. Take care. Everybody be well, and we'll talk with you soon.